Some medications save lives, and many are absolutely necessary. But here's something that doesn't get talked about enough. A number of widely used medicines can also put quiet stress on your heart. They may raise blood pressure, stiffen arteries, or even increase the risk of heart attack if taken long-term or without proper monitoring. Now, this doesn't mean you should stop any prescription suddenly. That could be dangerous. Instead, it's about awareness and having the right conversations with your doctor. In this video, we'll count down 7 common medications that research has linked to hidden risks for your heart. Stay tuned until the end, because number 1 is something you'll find in almost every household medicine cabinet. Number 7, non-steroidal anti-inflammatory drugs, NSAIDs. Pain relievers like ibuprofen, naproxen, and diclofenac are household names. Many people take them for headaches, back pain, arthritis, or sore muscles. Because they're available over the counter, they're often seen as harmless, but frequent or long-term use can quietly strain the cardiovascular system. NSAIDs can cause the body to retain fluid, increase sodium levels, and raise blood pressure, all of which put extra workload on the heart. In fact, research shows that people who use high doses of NSAIDs regularly have a higher risk of heart attack and stroke compared to those who don't. This doesn't mean you can never use them. For occasional aches and pains, they can be helpful. The risk comes when they're taken every day for chronic conditions, especially in older adults with existing heart or kidney issues. If that's the case, it's important to talk with a doctor about safer alternatives for long-term pain relief. And speaking of conditions that require daily medication, let's look at certain drugs used to control blood sugar, because some of them carry hidden risks for the heart. Number 6. Diabetes medications. Managing blood sugar is critical for preventing diabetes complications, but not every medication is without risk. Some older diabetes drugs, particularly a class called thiazolidinediones, which includes rosiglitazone and pioglitazone, have been linked to heart problems. The issue is that these drugs can cause the body to retain fluid. Over time, that extra fluid can strain the heart and worsen or even trigger heart failure. A large analysis in the New England Journal of Medicine found that rosiglitazone in particular was associated with an increased risk of heart attack. This creates a difficult situation. On one hand, keeping blood sugar under control is essential. On the other, the very drugs helping with glucose control may be quietly putting stress on the heart. The good news is that newer diabetes medications, such as SGLT2 inhibitors, have shown heart protective benefits. But many people, especially older adults, may still be taking these older drugs. If you or someone you know is on one of these medications, it's worth asking a doctor whether a review or update to the treatment plan is possible. Now, diabetes drugs aren't the only ones where the treatment can sometimes create its own risks. Even medications prescribed to lower blood pressure, the very thing we're trying to control, can backfire if they're not used correctly. Number 5. Blood pressure medications. When misused, blood pressure drugs are some of the most common prescriptions worldwide, and for good reason. They save lives. But certain ones, like clonidine or some beta blockers, can cause problems if they're suddenly stopped. When these medications are withdrawn too quickly, the body can react with rebound high blood pressure or dangerous changes in heart rhythm. In other words, the risk isn't usually in taking the medication, it's in stopping it the wrong way. That's why doctors often stress tapering these drugs slowly under supervision rather than quitting abruptly. Blood pressure drugs may cause problems if handled incorrectly, but other medications can be risky simply because people stay on them for too long. A good example is the acid reflux medicines many people use daily without thinking about their heart. Number 4. Proton pump inhibitors, PPIs for acid reflux. Drugs like omeprazole, lansoprazole, and esomeprazole are widely used for acid reflux and heartburn. Millions of people take them daily, and for short-term relief, they work very well. But the concern comes when people stay on them for months or even years without medical review. Some studies have linked long-term PPI use with a higher risk of heart attack and cardiovascular events. One possible explanation is that PPIs may interfere with the body's ability to produce nitric oxide, a molecule that keeps blood vessels relaxed and flexible. If blood vessels lose that flexibility, the risk of high blood pressure and plaque buildup increases. Many people don't even realize they're still taking PPIs long after the original problem has passed. What started as a short course for reflux can quietly turn into years of daily use, especially in older adults. That's why it's important to check in with a doctor to see if these drugs are still needed, or if there are safer, shorter-term alternatives. Now, while acid reflux medicines may cause hidden heart risks over time, some older antidepressants can affect the heart in a much more direct way, by interfering with heart rhythm itself. Number 3. Antidepressants. Depression is common, especially in older adults, and treatment is essential. But not all antidepressants are equal when it comes to heart safety. The older tricyclic antidepressants, such as amitriptyline and nortriptyline, are known to affect electrical signaling in the heart. This can lengthen the QT interval, a change in heart rhythm that raises the risk of arrhythmias and, in rare cases, sudden cardiac events. Tricyclics can also raise blood pressure and heart rate, which makes them less ideal for patients who already have cardiovascular problems. Today, newer antidepressants like SSRIs are generally safer for the heart, but tricyclics are still prescribed, especially when treating nerve pain alongside depression. That's why anyone taking these medications should be monitored closely, with both mental health and heart health considered together. While antidepressants may interfere with the way the heart beats, some cancer treatments can directly weaken the heart muscle itself, sometimes permanently. Number 2. Chemotherapy and cancer medications. Certain cancer treatments are life-saving, but they can also take a toll on the heart. Drugs like doxorubicin, a chemotherapy agent, and targeted therapies such as trastuzumab are well known for their potential to cause cardiotoxicity. This means they can weaken the heart muscle and reduce its ability to pump effectively, sometimes leading to heart failure. The risk increases with higher cumulative doses, and it can show up months or even years after treatment has ended. That's why many cancer centers now work closely with cardiologists to monitor patients' heart function during and after therapy. Echocardiograms and blood tests are often used to catch early signs of damage. Of course, these medications save lives, and for many patients, the benefits outweigh the risks. But knowing about this side effect means doctors and patients can take steps, like close monitoring, dose adjustments, or protective medications to reduce long-term harm. And finally, while chemotherapy drugs are usually prescribed in a hospital setting, our number one item is something much more common, an over-the-counter medicine for colds that many people don't realize can quietly stress the heart. Number 1. Over-the-counter decongestants, pseudoephedrine. At the top of our list are decongestants, medications many people take without thinking twice when they have a cold or stuffy nose. The key ingredient to watch for is pseudoephedrine. It works by narrowing blood vessels in the nasal passages, which reduces swelling and helps you breathe easier. But here's the catch. It doesn't just act on your nose, it constricts blood vessels throughout the body. This tightening of blood vessels can raise blood pressure, make the heart beat faster, and even trigger palpitations. For someone with high blood pressure, heart disease, or a history of stroke, that extra stress on the cardiovascular system can be dangerous, even after just a few doses. What makes this especially concerning is that pseudoephedrine is found in many common cold and flu combination products. People may not even realize they're taking it, especially if they just grab something off the shelf at the pharmacy. So, while it may seem harmless, it's worth checking labels and talking to your doctor or pharmacist before using decongestants, particularly if you already have heart concerns. As we've seen, the medications on this list aren't rare or exotic. They're everyday drugs that many people use without realizing the potential risks for the heart. And there you have it, 7 common medications that may quietly put stress on your heart. The takeaway isn't to stop these medications on your own. Many of them are life-saving and essential. Instead, it's about awareness. If you take any of these drugs regularly, talk with your doctor about the risks and whether monitoring or alternatives might be right for you. Also, don't miss our related video, 9 Deadly Oils That Cause Heart Attacks. It's an eye-opening look at how certain oils can silently damage your arteries. Which of these medications did you already know about, and which one surprised you most? Let us know in the comments. We'd love to hear from you. If you found this video helpful, give it a thumbs up, share it with a friend, and subscribe for more natural heart health tips. And if you'd like to support the channel, you can check out our merch or send us super thanks. It really helps us keep creating content for you. Thanks for watching and have a heart-healthy day.